I'm Bobby Fisher, and this is my Aesthetically Awkward podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. I'm Bobby Fisher, and this is my Aesthetically Awkward podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. I'm quickly recording an episode on my lunch. I'm about 24 hours out from a SkinPen microneedling treatment and it's CO2 to my eyelids. So this week, I just wanted to kind of walk you through that process, what it felt like, what the first 24 hours are like, and what I will be expecting to see over the next week while my skin recovers. So for those of you who are watching the video, you can tell I am definitely red. My eyelids are pink and definitely swollen. My upper lid looks heavier than it usually does, and that's just swelling. Perfectly normal. I'm in no pain whatsoever. The only area that's really sensitive is my eyes, because CO2 is a little more aggressive than microneedling on its own. When I squint or if I try to raise my brows, I can feel that tight sensation. It's just lightly irritated. It's no true pain. As far as the treatment is concerned, I numbed for about 30 minutes. The girls degreased all the lidocaine off of my skin, and then we did the microneedling first. So SkinPen is FDA indicated for face and neck, and they did a nice treatment all over my face, down my neck. They showed a little extra love to the texture on my cheeks, my acne scars, and my nasolabial folds. And then immediately after, we followed that up with the CO2 treatment to my eyelids. We used a mild setting. We don't go terribly aggressive anyway on the eyelids, mostly because it's a very, very sensitive area. You're prone to rebound hyperpigmentation there anyway. And we do not use the corneal shields or the intraocular shields in our practice. That would be a much more extensive procedure. So instead, we use a mild setting, and then we protect you with an external metal shield. Each treatment takes like less than 2 minutes per eyelid. So it's not terrible. Overall, the pain associated with SkinPen microneedling was like a 2 out of 10. It wasn't even really pain. It was like mildly uncomfortable. Worst part for me was my forehead. Those of you who experience like that sneezing sensation when you get your Botox, it's a similar sensation, just amplified by about 50, because we are repetitively poking that area with needles. So it stimulates those nerves and it makes you want to sneeze. And it's just mildly uncomfortable, but totally bearable. It's a pretty quick treatment. The SkinPen itself takes about 20 to 30 minutes to actually receive. Not bad at all. And then, like I said, you follow that up with the CO2 to the periorbital or periocular area. You're using that shield to protect the eyelashes so they are not singed or affected by this at all. Right after you feel warm, in our office, we have a Zimmer chiller. So that's like a cold wand that we use. So it blows nice cold air. That is really beneficial at keeping you comfortable throughout the CO2 treatments. SkinPen comes with its own kit, assuming you carry the SkinPen Elite and choose to purchase the Elite kits in your practice, which is what we do. Their protocol is to use their HG serum. That's the glide serum that is used throughout the procedure. You apply that topically for the first 24 hours. Well, we used up pretty much all of the serum. The girls were a little heavy-handed with that. They felt like they needed a little more glide, and I was blowing with the chiller wand, so I may have dried the glide out. Not a big deal. I instead used my Hyacinth Active Mist, which I use personally after every procedure that breaks my skin to reduce the risk of infection. Plus, it helps cool the skin. For me, it's a non-negotiable, so I'm always misting my face with that throughout the day. And then I use the Epicutis lipid serum. That is what I generally use after resurfacing treatments or after Pixelate RF microneedling. So I already know it's safe and effective after traditional microneedling. With that lipid serum, a little goes a long way. Talking a pea-size amount, gently pressed into the skin. Absolutely lovely. And then you can see, if you're watching the video, that I look very shiny. The reason for that is I am using a skin protectant. So you can use CeraVe healing ointment. You can use Aquaphor. You could use Vaseline if you wanted to, or I am using Curad skin protectant. A little bit goes a long way. I focused it primarily on my eyes. So I used less than a pea-size amount. And then I tapped a little bit on my eyes because that's where I received the CO2 and I don't want the area to get too dried out. I'll reapply that as needed throughout the day. And then the excess, I'm going ahead and applying everywhere else just to further lock in the hydration into my skin. I'm only cleansing twice a day with my Epicutis. I'll use lukewarm to cool water. You do not want hot water on your face because it feels like a sunburn. So lukewarm to cool water using my Epicutis oil cleanser, patting that dry with a clean towel. A little bit of the lipid serum, a little bit of the Hivea cream. Right now, I'm 24 hours out, so I could theoretically go ahead and apply some SPF. When I got up this morning, it had only been 12 hours, so I skipped it. So I won't actually apply any SPF until tomorrow. I'm staying indoors today. This is the most sunlight I'm getting is in my office for filming purposes, so you can see my skin. I'm not doing any significant damage, so I'm fine, people. Don't chastise me for my lack of SPF today. But starting tomorrow, I will definitely be wearing SPF to help protect my skin. This is as red as it's going to get. I'll get some bronze areas and I will likely peel and flake. If you want to see the entire process, best thing to do is go follow me on Instagram, BobbyTheNP_LuxLift. I'm posting updates in my stories, so you can follow along, see what my downtime's like. I did use a mild setting on the eyelids, so if you have more significant laxity on your eyelids and you're wanting a little more aggressive of a treatment, we can do it. Like, so mine was kind of middle range, but we can do a little bit more aggressive in the appropriate candidate. But we don't do the fully ablative that you see done on plastic surgeons' tables or ophthalmological surgeons' tables where they're doing those intraocular eye shields. It takes numbing. It takes a special fitting, special training to do that. We're not doing that type of a procedure in our office in the outpatient setting. And for a true fully ablative CO2 laser, the outpatient setting, it's just not appropriate. The reason being is because it is so intense and it is so uncomfortable. It's best done under anesthesia. We don't offer those services here. We can do oral anxiety medications. I do prescribe that. It's a form of oral conscious sedation, but it's still something we take very seriously to make sure that you remain safe and stable throughout the procedure, and you will need a driver to take you home. Okay, I think that's it for this week. Appreciate you tuning in. Send me a DM over on Instagram if you have any questions, and I will talk to you next week.